Now that Medicare has released the 2021 numbers for both the premiums and deductibles, it's time to take a closer look into figuring out what these mean. So today I'm going to go over what a deductible is, what the Medicare Part A, B, and D deductibles are for 2021, and how often you might pay these, because you might pay them more than once in a year. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk about the Medicare deductibles. That's right, deductibles, because there is more than one. And when we first start to look at insurance, we're kind of bombarded with a lot of terms like premium, deductible, out-of-pocket maximum. That's kind of hard to determine what each of these means. So today I'm going to define a deductible for you, as well as go into the different parts of Medicare and their different deductibles and when you would pay that and how often you might pay it. Before we get started, if you find the information in this video helpful, I'd appreciate if you give it a thumbs up and subscribe, and leave a comment down below any questions you have about the Medicare deductibles. And we can dive right in and talking about what a deductible is. So when we look at deductibles, the first thing we want to do is define it. So a deductible is defined as a specified amount of money that the insured must pay before the insurance company will pay a claim. So essentially, you pay first with a deductible. So right up front, calendar year starts, you have a deductible, you pay before the insurance company pays at all. Then, once you've met your deductible, the insurance company is going to kick in and start paying their portion. They're not going to pay 100%. It's going to depend on your plan benefits, but the insurance company will now start paying because you have met your deductible. So, quick example, say you have a deductible of $200. We'll make it a flat $200, make it easy. And January 1st, you have a doctor's appointment that costs $75. When you go to the doctor, you are going to pay that full $75. The insurance company is not going to pay any portion of that because you have not yet met your $200 deductible. So that $75 you're paying goes toward your $200 deductible, and now you're left with a $125 deductible. So after maybe one, possibly two appointments, you've likely met that $200, and now the insurance company is going to start to pay. So again, you pay your portion, and then the insurance company pays their portion. And with Medicare, what's really important to know is there are different parts of Medicare, and there's also different deductibles for those parts. So they've made it as confusing as possible by splitting up your coverage, having deductibles that are all different numbers, different amounts, and you may pay it once a year, you may pay it more than once a year, depending on the part of Medicare. I know it sounds really confusing, but I'm going to get deeper into it for you and kind of explain how each Medicare deductible works. So first we'll start off with just the basic numbers. So you're going to have a deductible for Medicare Part A and Medicare Part B. There's also a Part D deductible, but I'll get to that a little bit later. So Part A is your hospital coverage, so your room and board when you're in the hospital. And Part B is going to be your outpatient coverage, so any kind of doctor services, sometimes even in the hospital, if it's considered outpatient, will fall under Part B. And like I said, separate parts, separate deductibles. So in 2021, the Medicare Part A deductible is $1,484, and the Medicare Part B deductible is $203. So it's a slight increase from 2020 to $1,484 and $203. So let's look at each of these a little bit deeper. So like I said, the Medicare Part A deductible is $1,484, and that is per benefit period. So you heard that right. It is not an annual deductible. It's a per benefit period deductible. And a benefit period is about 60 days. So let's explain how this would work. So say you're hospitalized in the beginning of the year. You're put in the hospital, you stay for a couple days, and then 4 days later, you are released from the hospital. You paid your $1,484 deductible, and now you've been released. If you are hospitalized again within those 60 days, that deductible that you paid initially applies to your next hospitalization. So as long as you are re-hospitalized within 60 days, you don't have to pay that $1,484 again. So say you're hospitalized 30 days later, 15 days later, doesn't matter as long as it falls within those 60 days. However, If you go more than 60 days without being hospitalized, which I hope we all do, who wants to be hospitalized more than once in 60 days, but say you're hospitalized again more than 60 days later, you're going to pay that Part A deductible again because your benefit period has run out. So now you are again responsible for that $1,484 for the second time in a year. So essentially, if you are super unlucky and you're hospitalized every 61 days, you're going to pay that Part A deductible every single time. It's really important to understand this is not annual and there's no cap to it. You could pay that multiple times a year depending on how often you're hospitalized more than 60 days apart. Now, there's coverage that helps you cover this Part A deductible because, of course, $1,484 is a lot of money if you're paying that multiple times a year. Now, a lot of people can just pull that out of their pocket and pay $1,484 every hospitalization. Things like Medicare Supplement Plans will usually cover your Part A deductible. The popular plans like G and N and even the old F cover that Part A deductible regardless of how many times you were hospitalized. There's no limit on how often they cover that Part A deductible. And that's what I do. I assist people in finding the best Medicare Supplement Plan options for them. You can always give me a call. My number is 833-65-JAMIE, or you can visit my website, MedicareByJamie.com, and I'll walk you through the coverage for these deductibles on the Medicare Supplement Plans. So like I said, most Medicare supplements do cover the Part A deductible, but if you look a little bit lower under Part B deductible, not as covered as often. And there are some plans that cover it like F and C, but those are no longer available to new Medicare enrollees who turn 65 January 2020 or later. So if you turn 65 in 2020 or beyond, you can no longer enroll in a Medicare supplement plan that covers your Part B deductible. Now, if you're in a plan that already covered it, you are still entitled to those benefits, but speaking to new enrollees, you're going to be responsible for that Part B deductible. But luckily, it's much smaller than the Part A deductible and it's not as often. So the Medicare Part B deductible is $203 and it's an annual deductible. So that's right, you only pay it once per year. So if you have a doc's appointment in January and you pay the $203, that's it. You're done. You've met your Part B deductible. You don't have to worry about that deductible again until the next year. Fantastic. It's out of the way. Good thing to remember too about the Part B deductible is not every service under Medicare Part B has the deductible come into play. So there's certain preventative procedures like your Welcome to Medicare visit, a yearly wellness visit, screening mammograms, things like that, that can be preventative services that as long as your doctor takes Medicare assignment, your Part B deductible will not come into play. So it's really good to remember that you're going to pay that once a year, just dependent on your service. Also, great thing to remember about deductibles, you only pay them if you use the plan. So say you have Medicare and you don't go to the doctor at all this year, you won't pay your deductible. It's really easy to remember. You only pay it as you use the plan. So Part A deductible is per benefit period. Part B deductible is annual. Now, the third deductible I wanted to touch on is your Part D deductible. Now, I put here a number for Part D deductible is $445, and just like Part B, it's per calendar year. But $445, you can see that asterisk because that's the highest the Part D deductible can be. So Part D prescription drug deductibles can range anywhere from $0 to $445. Typically, you're going to see them closer to that $445, but they cannot be higher than that, and it's an annual deductible. So with your Part D plan, it's going to depend on the specifics of your plan, but just know it's an annual deductible and can never be higher than $445. I hope you found the information in this video helpful. Like I said, dependent on the part of Medicare, there's different deductibles. You want to remember kind of how often you can pay them and what they are. But if you have something like a Medicare Supplement Plan, the Part A deductible, you don't really have to worry about. Part B, it's there, but it's not very big. $203, we can definitely handle that. If you have any questions, please don't hesitate to give me a call. My number is 833-65-JAMIE. You can also visit my website, MedicareByJamie.com. If you stay tuned, I'm going to give you a tour of my website and show you how to request a free Medicare supplement quote. There's no cost to you to work with me, and I will go through all of your options for the best Medicare supplement plans. And if you found the information in this video helpful, I would appreciate it if you give it a thumbs up and subscribe and leave a comment down below. Thanks for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare Supplement Plan quote. And that's what I do. I assist people in finding the best Medicare Supplement Plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.